Welcome to Daily Health Advice, where we share information that's relatable, easy to understand, and most importantly, practical and applicable to your everyday life. Dear friends, have you ever felt this way? One morning you wake up feeling a little dizzy, with a mild headache, and your heart seems to be beating faster than usual. Or maybe it's in the evening, after a long, tiring day. You suddenly feel uneasy, slightly short of breath, and your heart is pounding for no clear reason. And then, almost instinctively, you grab the blood pressure monitor at home to check. The numbers appear 165/95. In that instant, a wave of anxiety washes over you. Your heart starts beating even faster. Questions begin to echo in your mind. Am I about to have a stroke? Should I go to the hospital right now? Is something seriously wrong with my body? Many people, upon seeing a high reading like that, immediately search online, call their doctor, or even increase their medication dose on their own. On the other hand, there are also those who see a high number, but since they still feel fine, still talking and laughing as usual, they brush it off and ignore it. Both of these extremes, overreacting with fear or being too dismissive, are not ideal. And more often than not, they stem from one thing: not fully understanding blood pressure. The truth is, our blood pressure isn't fixed. It fluctuates throughout the day, depending on our emotions, movements, and even something as simple as a cup of coffee or a few steps up the stairs can temporarily raise the number. That reading doesn't always reflect something serious. But there are also times when a number that doesn't seem very high could actually be a silent warning sign of a long-term risk within the body, if we don't catch it early. What truly matters isn't whether the number is high or low. It's what we understand from that number. Just because the monitor shows 140 or 150 doesn't always mean it's dangerous, and seeing a normal reading doesn't mean you can relax forever. The real issue lies in how we measure it, under what conditions, whether we're using the right technique, whether we measure regularly, and most importantly, whether we actually understand what blood pressure is. I believe that once we truly understand how blood pressure works, what factors influence its changes, and know when to stay calm and observe versus when we really need to take action, we'll no longer live in vague fear, and we won't be thrown into panic or confusion by a few numbers on a screen. And that is exactly why I'm making this video today, to walk with you, step by step, through how to properly monitor your blood pressure at home, recognize when a reading is worth worrying about, and how to adjust your lifestyle in a natural and safe way, without relying entirely on medication. So if you have a blood pressure monitor at home but still feel uneasy every time you look at the numbers, if you're taking medication regularly but don't fully understand your own condition, or if you simply want to take better care of your heart every day, then this video is for you. And to begin that journey, the first and most important thing we need to do is to understand blood pressure correctly. Because once we understand it, we won't let ourselves be controlled by the numbers. Instead, we'll learn to listen to our body with wisdom and take control of our health with calm and confidence. So I invite you to continue listening. To take care of our blood pressure proactively, the first and most essential step is to truly understand what blood pressure is. Understand it, so we're no longer confused when we see an unusual number. Understand it, so we know how to listen to our body, not just follow what the monitor says. Inside our body is a wonderfully intricate and dynamic network of blood vessels called arteries. You can picture them like soft, flexible tubes that carry oxygen-rich, nutrient-filled blood from the heart to every part of the body, to every cell, every organ, every corner of life. When the heart contracts to pump blood through the body, it creates a pushing force, and that force puts pressure on the artery walls. That pressure is what we call blood pressure. The blood pressure reading we usually see on a monitor consists of two numbers. The top number is the systolic pressure, which reflects the pressure when the heart is actively beating and contracting. The bottom number is the diastolic pressure, which reflects the pressure when the heart is resting between beats. For example, if your reading is 125/72 or 125/72 mmHg, the 125 represents the pressure when the heart is pumping blood, and the 72 is when the heart is at rest. Both numbers are equally important, because even if just one of them exceeds the normal range, your cardiovascular system is already having to work harder than it should. So, what is considered a normal range? According to reputable health organizations like the American Heart Association, An ideal blood pressure should be below 120/80 mmHg. Once it reaches 140/90 or higher, it is considered high blood pressure, and close monitoring along with lifestyle adjustments is necessary. Interestingly, more recent studies show that even a level of 130/80, if it persists over time, can increase the risk of damage to the heart, kidneys, and brain's blood vessels, especially in older adults. However, and this is something I really want you to remember clearly, a single high reading does not mean you have high blood pressure. Blood pressure is not a static number. It changes hour by hour, minute by minute, affected by a wide range of factors throughout the day. You might have just had a coffee, walked up some stairs, got annoyed over something, or are simply feeling anxious before a doctor's appointment. And just like that, your blood pressure can spike higher than usual. I once met a gentleman in his 60s who, every time he visited the hospital, had a reading as high as 160 to 170. But when he measured at home, sitting calmly after breakfast, the reading was just 125/78. The reason? Every time he went to the hospital, he felt nervous, anxious, his heart raced, and his blood pressure rose with that emotion. This is known as the white coat syndrome, a temporary spike in blood pressure triggered by the medical environment, even though the person doesn't actually have chronic hypertension. That's why what really matters isn't a one-off number. It's a continuous, systematic process of monitoring. Blood pressure only truly reflects your real condition when it's measured properly, at the right time, under the right circumstances. So, if you get a reading of 150/90 but you're tired, stressed, or just did some physical activity, sit down, take a few deep breaths, and measure again. Very often, after just a few calm breaths, the number will drop back to normal. On the other hand, if your blood pressure is high but you still feel fine, alert, and energetic, don't let that make you careless. High blood pressure is a silent killer, quietly damaging your heart, kidneys, and brain day by day, without any obvious symptoms. That's why the best way to protect your cardiovascular health isn't to wait until you feel dizzy or have a headache before checking, but to make monitoring your blood pressure a part of your daily routine, just like brushing your teeth, washing your face, or eating breakfast. Measure correctly, understand correctly, and don't let the numbers cause panic. That's the first step in truly taking control of your health. But to do that, we need to start with the most basic thing, and that is knowing how to measure blood pressure at home accurately and reliably. Let's keep learning together. Dear friends, one thing I've noticed from speaking with many patients is this. A lot of people, even those who already own a blood pressure monitor and use it regularly, still don't know how to measure properly. And the result? Inaccurate readings that cause unnecessary anxiety. Some people get extremely worried just because the numbers seem a little high. Others are even prescribed medications simply because they measured incorrectly once, when, in reality, there was nothing seriously wrong with their body at all. As a result, instead of being a trustworthy companion, the blood pressure monitor becomes a source of confusion and fear. That's why I want to guide you clearly, step by step, so that measuring your blood pressure at home becomes simple, accurate, and something you can feel confident about every day. First of all, remember that the timing of the measurement and your physical state greatly affect the results. Many people take a reading right after eating, drinking coffee, or climbing stairs, and this leads to inaccurate numbers. So ideally, you should sit still and relax for about 5 minutes before taking a measurement. Avoid measuring right after eating, drinking caffeinated beverages, smoking, or exercising. As for posture, sit in a chair with a backrest, feet flat on the floor, and do not cross your legs. Rest your arm on a table at heart level. This is a very important detail. If your arm is too low or too high, the numbers can be off. Make sure your sleeve is rolled up neatly so that the cuff, the band that wraps around your arm, is in direct contact with your skin. Avoid thick or tight clothing that could interfere with the pressure. The cuff should fit snugly, not too loose and not too tight, and be placed about 2 finger widths above the elbow. While measuring, stay completely silent. No talking, no movement, and try not to think too hard. Even something as small as speaking or laughing can cause the result to shift significantly. I've tested this on myself. While casually chatting, my blood pressure read 154/83. But when I sat quietly, breathing evenly, and measured again, it dropped to 110/70. that shows just how meaningless a reading can be if it's done incorrectly. To effectively monitor your blood pressure, make it a habit to measure twice a day, once in the morning before eating or taking any medication, and once at night before going to bed. Each time, measure twice in a row, about 1 to 2 minutes apart, and take the average. Do this consistently for 5 to 7 days, and record the results in a notebook or a health tracking app to share with your doctor. Another common question is, which arm should I use? The answer is, use your non-dominant arm, as it's usually easier to handle. For example, if you're right-handed, measure on your left arm. What matters most is to stick with the same arm every time for consistency. As for the device, I recommend using an upper arm blood pressure monitor, as it's much more accurate than wrist models. When choosing a monitor, look for those that have been validated by reputable health organizations, such as the American Heart Association, AHA. You can check their website for a list of verified devices to ensure peace of mind. A good machine, correct posture, and a calm mindset. These 3 factors alone can help you manage your blood pressure daily without unnecessary worry over incorrect readings. And once you know how to measure it correctly, the next thing to understand is when a high reading is just temporary and should be monitored, versus when it is truly dangerous and requires immediate medical attention. Not every reading of 150 or 160 should send you into a panic. But you also shouldn't ignore high blood pressure just because you feel fine. Understanding that boundary is what helps you stay calm in critical moments and gives you the knowledge to protect yourself before it's too late. So right now, let's take a closer look together. When is high blood pressure truly dangerous? And how can you respond without fear, but also without complacency? Dear friends, one of the most common fears among people who use a home blood pressure monitor is the intense anxiety that strikes whenever they see an abnormally high number. But as I've mentioned, high blood pressure doesn't always mean an emergency. What truly matters is being able to tell the difference between a reading that needs monitoring and one that calls for immediate action. So then, the big question is, when is high blood pressure actually dangerous? If your blood pressure reading ever reaches over 180/120 mmHg, and it comes with one or more serious symptoms, like chest pain, shortness of breath, severe headache, blurred vision, double vision, numbness or weakness on one side of the body, slurred speech, or trouble speaking clearly, this is a clear sign of a medical emergency. In this situation, you should not wait or try to manage it at home. You need to go to the hospital immediately to be evaluated and treated without delay. Why is it an emergency? Because at that moment, the extremely high blood pressure is causing significant damage to critical organs like the heart, brain, kidneys, or major blood vessels. If left untreated, it can lead to stroke, heart attack, acute kidney failure, and the consequences can be devastating. However, there are also times when your blood pressure might be high, say 150, 160, or even 170, but you don't feel any obvious discomfort. Naturally, many people will ask, should I be worried? The answer is, don't panic just yet. Give your body a little more time to speak. In situations like this, the best thing you can do is sit down and get into a comfortable position. Breathe in deeply, hold for a few seconds, and exhale slowly. Do this steadily for about 5 minutes to calm your nervous system. Then take your blood pressure again. If the reading drops significantly, for example, from 160/95 down to 135/85, it's very likely that the first number was influenced by stress, fatigue, or another temporary physiological factor. In that case, you can feel more at ease. But if your pressure remains high even after resting, you should reach out to your doctor for further guidance or schedule an appointment as soon as possible. It's important to remember, high blood pressure often shows no symptoms at all. Many people live with hypertension for years without feeling a thing, until one day, they suffer a stroke, heart failure, or kidney failure. That's why it's called the silent killer, because it silently damages your internal organs without you ever noticing. So, just because you feel fine today, eating, walking, working without issue, doesn't necessarily mean you're in the clear. What truly keeps you safe is whether or not you're monitoring your blood pressure regularly, and whether or not you understand your own numbers. And don't let fear take over every time you see a high reading. Instead, ask yourself, did I measure it correctly? Did I rest before taking it? Has something been stressing me out lately? Only when you stay calm can you properly assess the situation. And more importantly, The most sustainable way to stop living in fear of blood pressure is to build a lifestyle that naturally keeps it stable each day, not just rely on medication. The amazing part is, you don't need massive changes or complicated treatments to do this. Sometimes, just small things, like using a little less salt in your meals, drinking 1 extra glass of water a day, or taking a short walk after dinner, can make a big difference. And that's exactly what I'd like to share with you next. A lifestyle that lowers and stabilizes blood pressure, simple, natural, and long-lasting. Dear friends, the wonderful truth is that you don't have to rely entirely on medication to control your blood pressure. In fact, it's the small habits in our daily lives, from the way we eat, the way we sleep, to the way we breathe and move, that hold the most lasting power to stabilize blood pressure in the long run. And the starting point for all of it is our diet. You may not realize it, but most of the salt your body absorbs each day doesn't actually come from the salt you sprinkled during cooking. It comes from processed foods, instant noodles, sausages, cold cuts, industrial bread, even canned soups. Those small seasoning cubes and convenient dipping packets, while handy, contain a large amount of sodium. And sodium is the main culprit behind water retention, increased pressure on blood vessel walls, and elevated blood pressure. That's why simply cutting down on salt a little each day and prioritizing home-cooked meals using natural seasonings like garlic, lemon, onions, and fresh herbs can significantly ease the burden on your heart. Be sure to read nutrition labels carefully. Choose products that contain less than 140 milligrams of sodium per serving, which is the recommended safe level. In addition, increasing potassium in your diet is a natural and effective way to help relax your blood vessels and lower blood pressure. Familiar foods like bananas, sweet potatoes, spinach, avocados, beans, and unsweetened yogurt are all excellent sources of potassium. When you eat more fresh, whole foods, not only are you boosting potassium intake, but you're also indirectly reducing sodium, a double win for your blood pressure. Next, if you're carrying excess weight, even a modest weight loss of just 5 to 10% of your body weight can lead to a noticeable improvement in blood pressure. You don't need to follow strict diets or engage in intense workouts. Just brisk walking for 30 minutes a day, 5 days a week, can make a positive difference. Your blood vessels will become more flexible, your heart stronger, and your blood pressure more stable over time. One subtle but powerful factor is psychological stress. Chronic stress causes the body to release hormones that constrict blood vessels and raise both heart rate and blood pressure. That's why learning to relax is one of the most effective non-drug treatments available. You can practice deep breathing, light meditation, listen to your favorite music, enjoy a quiet cup of tea, or simply sit and watch the sunset from your porch. These quiet moments can sometimes be the most powerful medicine for your heart. And if you still smoke, be aware that every cigarette causes an immediate spike in blood pressure. Tobacco smoke constricts blood vessels, damages the inner lining of arteries, and over time contributes to atherosclerosis, one of the leading causes of stroke and heart attacks. Quitting smoking, though difficult, is one of the most valuable decisions you can make for your heart health. Alcohol, when consumed in excess, is also harmful. But if you're currently drinking in moderation, for example, 1 drink a day for women and 2 for men, it may still be acceptable. That said, it's always best to limit alcohol as much as possible, especially if you have a history of high blood pressure. Finally, one critical aspect that often gets overlooked: sleep. Sleeping too little, too lightly, or too irregularly can all negatively impact blood pressure. Try to maintain a consistent sleep schedule, getting 7 to 9 hours of quality sleep each night, to help regulate your body's rhythms and minimize fluctuations in blood pressure throughout the day. So, as you can see, managing your blood pressure doesn't require anything extreme. You don't have to wait until illness appears to start caring. Just by nurturing small habits every day, through your meals, your sleep, each step you take, each deep breath you draw, you are already supporting a healthier heart, a more stable blood pressure, and a more sustainable life. And if you're wondering right now, so what should I eat every day to support healthy blood pressure naturally? Which foods truly benefit your arteries, your heart, and your numbers? Right now, I'll share with you some simple, easy-to-find foods that have been scientifically proven to support blood pressure effectively. Dear friends, now that we've talked about healthy lifestyle habits for managing blood pressure, it's time to dive deeper into one of the most familiar and powerful factors: food. What you put into your body each day doesn't just nourish you, it can also heal you. Or, if chosen poorly, it can silently cause harm. The good news is, nature has gifted us with a wide variety of foods that can naturally, gently, and effectively support healthy blood pressure without the need for medication. First, let's talk about leafy green vegetables like kale, spinach, and Swiss chard. These greens are not only rich in fiber, but also packed with potassium, magnesium, and nitrates, three key elements that help relax blood vessels, soften arterial walls, and promote smoother circulation. If your daily meals include a plate of steamed greens or a bowl of fresh vegetable soup, your heart will thank you. Next are berries, like blueberries, strawberries, and raspberries. These tiny fruits contain flavonoids, a group of antioxidants known to improve blood vessel elasticity and gently lower blood pressure. You don't need a lot, just a small handful a few times a week, mixed into yogurt or enjoyed as a dessert, can benefit your cardiovascular health. One root vegetable that often goes underappreciated is beetroot. Beets are naturally high in nitrates, which are converted in the body into nitric oxide, a compound that helps dilate blood vessels and improve circulation. You can juice them, roast them, or boil them and pair with other dishes, simple and effective. Oats, a humble grain with incredible benefits. Oats contain beta-glucan, a type of soluble fiber that lowers bad cholesterol and improves blood vessel function. A bowl of plain oatmeal in the morning, topped with fresh fruit and seeds, is both gentle on your stomach and friendly to your blood pressure. And don't overlook garlic, a common kitchen staple that's actually a powerful ally for your arteries. Garlic contains allicin, a compound that helps dilate blood vessels and reduce pressure on the arterial walls. Just adding a few cloves of fresh garlic to your meals each day, or taking a standardized garlic supplement, can support your heart health effectively. If you enjoy fish, go for fatty varieties like salmon, mackerel, or sardines. These are rich in omega-3 fatty acids, healthy fats that reduce inflammation, lower blood pressure, and protect arterial walls. Eating fish just twice a week can already make a noticeable difference. If you're not a fan of fish, you can still get omega-3s from plant-based sources like flax seeds, chia seeds, and walnuts. These are easy to sprinkle on breakfast bowls, salads, or oatmeal, and they benefit both your blood pressure and brain function. And here's something fun. If you enjoy the bittersweet flavor of dark chocolate, there's good news. A few squares of chocolate with at least 70% cocoa content each day can also support healthy blood pressure. The flavonoids in dark chocolate help improve blood flow. Just remember, moderation is key, as too much sugar or calories can backfire. Lastly, don't forget the importance of hydration. When the body is dehydrated, blood vessels tend to constrict, which increases blood pressure. So be sure to drink 6 to 8 glasses of water each day, especially in hot weather or after physical activity. As you can see, caring for your blood pressure doesn't require anything out of reach. By simply choosing the right foods, eating mindfully, but not excessively, and keeping up the habit each day, your body will naturally begin to adjust and heal itself. However, alongside all the right things to do, there's another important issue to address: the dangerous misconceptions that are still very common in the community. These misunderstandings, seemingly harmless, can lead people to become overly complacent or worry in the wrong way, resulting in serious consequences. Coming up next, I'll share with you some of the most widespread, but risky, myths about blood pressure, so we can understand it correctly, care for it wisely, and protect our health with greater clarity and confidence. Dear friends, on the journey of caring for our health, especially when it comes to blood pressure, there's an unfortunate truth. Many people, even after measuring their pressure, taking medication, and listening to advice, still live with quiet, dangerous misconceptions. These mistaken beliefs may seem harmless, but they can lead us to ignore important warning signs or act the wrong way, causing consequences that could have been avoided. The first and most common misconception is this: high blood pressure always comes with clear symptoms. Many people believe they only need to check their blood pressure when they feel dizzy, have a headache, or feel fatigued. If they feel normal, they assume everything's fine. But the truth is, high blood pressure often causes no noticeable symptoms at all. It quietly damages the heart, kidneys, and blood vessels day by day, without the person realizing it. That's why it's known as the silent killer. So don't wait until symptoms appear. Make blood pressure monitoring a regular habit, like brushing your teeth or drinking water each day. The second misconception is, I'm already taking medication and my blood pressure is normal, so I'm cured and can stop taking it. This is extremely dangerous. Blood pressure medication isn't a cure, it's a tool to control your condition. If you stop suddenly, your blood pressure can spike back up, possibly to even more dangerous levels, because your body hasn't had time to adjust. Any change in dosage should always be gradual and under a doctor's supervision, never on your own. The third misconception, I'm still young. High blood pressure is only for older people. Sadly, this belief no longer holds true today. More and more young people under 40 are being diagnosed with hypertension, often due to a sedentary lifestyle, salty diets, chronic stress, and poor sleep. Many don't notice anything wrong and skip regular checkups, only to find out too late, after damage has been done. That's why no matter your age, monitoring your blood pressure is always important. The next misconception, 130/85 is normal, nothing to worry about. That might not sound very high, but recent studies show that if this level is sustained over time, it still increases the risk of heart attacks and strokes. The issue isn't about hitting a magic number, it's about the trend your blood pressure is taking. Early recognition and adjustment are key. Don't wait until your numbers pass a dramatic threshold to start paying attention. The fifth misconception, as long as I eat healthy, I don't need medication. It's absolutely true that a healthy diet and regular activity are crucial foundations. But if you have genetic factors, underlying health conditions, or your blood pressure is already too high, then lifestyle alone may not be enough. In such cases, the safest and most effective approach is a combination of medical treatment and healthy habits. Finally, a very common trap. My blood pressure is stable now, so I can ease up on the good habits. In reality, your blood pressure is only stable because of those healthy choices. If you stop exercising, start eating salty foods again, or throw off your sleep schedule, your blood pressure can rise quickly. Managing blood pressure is not a one-time goal, it's a long-term journey. You don't need to be perfect, but you do need to be consistent. Dear friends, these kinds of misconceptions, if not addressed, can steer us in the wrong direction. We end up worrying about the wrong things, or worse, missing the chance to take care of ourselves early on. But each time we understand just a little more, we take another step toward a life that's healthier, more proactive, and more at peace. So now the question is, after everything we've just learned, where do we begin? Do we need to overhaul our entire lifestyle right away? The answer is, no need to do too much at once. All it takes is one small thing, done consistently. And that's exactly what I'd like to share with you next. Small actions, big impact. Start with the simplest steps, and they can lead to lasting change for your heart and your blood pressure. Dear friends, after everything we've walked through together, from understanding what blood pressure truly means, learning how to measure it accurately, recognizing when it's dangerous, building a healthier lifestyle, and choosing the right foods for your heart, what remains is no longer knowledge, it's action. But I understand, even when we know what to do, it can still feel overwhelming to take that first step. We ask ourselves, do I have to change everything all at once? Do I need to do it all right now? Is it too late to start? The answer is no. You don't have to do everything in one day. You don't have to change your entire life overnight. You don't have to become a perfectly healthy person by tomorrow. All you need to do is start with one small action every day. Maybe it's drinking an extra glass of water in the morning. Maybe it's taking a short walk after dinner instead of heading straight to the couch. Maybe it's using half a teaspoon less salt in your soup today, or seasoning with garlic, scallions, and ginger instead of MSG or seasoning powder. Or maybe it's simply taking a few quiet minutes before bed, breathing deeply, closing your eyes, and allowing your heart to rest just a little more gently. These small actions, when repeated daily, won't feel like extra effort anymore. They'll become a natural part of your rhythm, part of a lifestyle that is calmer, healthier, and more balanced. Sometimes, we think that being healthy means doing something big, making drastic changes. But in reality, our bodies don't need anything complicated. What they need is consistency, a little care, a little attention, each and every day. A glass of water, a few steps, one mindful breath, simple as they may seem, They carry enormous power when done regularly and with intention. Blood pressure, as I've said, is not just a number. It's a mirror reflecting your way of living. Every choice you make today, no matter how small, is noticed by your body, and it shows up in your blood pressure, your heartbeat, and your sleep. And most importantly, you are in control. Don't let the numbers on the screen scare you, worry you, or become a source of anxiety. Instead, let them be your companion. Let your blood pressure monitor become a gentle reminder to care for yourself more, to slow down a little, and to truly listen to what your body is telling you. And if today you feel like you haven't done anything significant, that's okay too. This journey doesn't require perfection. It only asks for patience and a little kindness toward yourself. So, right as this video ends, I invite you to choose one simple thing you will do today. Maybe it's measuring your blood pressure properly tomorrow morning. Maybe it's inviting a loved one to join you for a walk. Maybe it's swapping a salty lunch for a veggie-filled one. Or maybe it's sitting quietly for 3 minutes, closing your eyes, and softly saying to yourself, "Starting today, I will take better care of myself." Share the action you choose in the comments below, because who knows, your choice might inspire someone else to begin their own journey. And when we spread small acts of care together, we begin to build a community that's healthier, more mindful, and more empowered, one day at a time. If you found this video helpful, don't forget to hit the like button so I know you're here, you're listening, and we're on this path together. And subscribe to the Daily Health Advice channel so we can continue to meet, share, learn, and grow healthier day by day. I'm your health companion, and I'll always be here to walk alongside you every single day.